How should you approach first-line therapy in multiple sclerosis? What factors will affect your decision to modify treatment? Hello, I'm Aaron Miller, Medical Director of the Corinne Goldsmith Dickinson Center for Multiple Sclerosis and Professor of Neurology at the Icahn School of Medicine at Mount Sinai in New York. I am joined by a distinguished faculty to discuss these and other issues. Dr. Bruce Cohen, Professor in the Davey Department of Neurology and Clinical Neurosciences at Northwestern University's Feinberg School of Medicine in Chicago, Illinois. And Dr. Andrew Goodman, Professor of Neurology and Director of the Multiple Sclerosis Center and Chief of the Neuroimmunology Unit in the Department of Neurology at the University of Rochester Medical Center in Rochester, New York. I would like to thank you for viewing disease management in multiple sclerosis. This activity is sponsored by Vindico Medical Education and is supported by an educational grant from EMD Serono. Well, welcome, Bruce and Andrew. It's nice to be with you to discuss an important topic that we each spend so much of our time with. We're going to focus today on the treatment of people with multiple sclerosis. And that, of course, encompasses several rubrics, but I'd like to start right off by addressing the subject of disease-modifying therapy. And I'd like to start that by taking an actual vignette. So let's start with you, Bruce. So suppose a young woman, let's make her 25 years old, came in having had a very recent bout of optic neuritis, and she has a brain MRI that shows a gadolinium-enhancing lesion in the periventricular space and another lesion that's juxtacortical. What would you recommend to this patient in terms of treatment? Or would you, in fact, tell her she had MS at that point?
So, as you've presented it, Aaron, this patient meets the current diagnostic criteria for MS. She has a clinical syndrome, which is typical of a central nervous system demyelinating event. She has evidence of disease activity in the form of an enhancing lesion in another location typical of MS in the brain, and evidence of a non-enhancing lesion in another location also typical of MS in the brain. So by the 2010 McDonald criteria, she in fact meets the definition.